Right now, there are more than 110,000 Tennesseans living with Alzheimer's disease, and that number is expected to rise in the near future. Receiving an Alzheimer's diagnosis can be a confusing situation and lead to many questions for those that care for family members with Alzheimer's. Tabitha Ebert with Alzheimer's Association and Dr. Norman Moore with the Quillen College of Medicine join us this morning to tell us about an event where caregivers can get some of those tough questions answered. And it is a great event that you all have planned. Give us a few details, if you would, Tabitha, about the event itself.
Certainly. Well, this event will be taking place actually on a monthly basis. We will be having it every month. First event will be tomorrow at noon. The New Food City on Save Franklin will be providing lunch tomorrow.
Okay.
And this will be an opportunity for caregivers or anyone in the community to come and ask those difficult questions and to find a little bit more information about current research, questions they may have that they may not have had a chance to ask their physician about Alzheimer's disease to Dr. Moore.
And Dr. Moore, you're going to be there as the keynote speaker. What are some of the subjects you're wanting to broach with folks tomorrow?
Well, I want to tell them about how much advance has been made in both the diagnosis and the treatment of Alzheimer's. Until a couple of years ago, the only diagnosis that was valid was after the patient died. Unfortunately, it was done at autopsy. The good news is that we now have brain scans that can give us the same information. So it makes it that we can do better research, because we used to be that out of every 100 patients we studied, we knew 20 of the 100 did not have the disease because we couldn't make a correct diagnosis. That made it difficult for the 20 people that you knew didn't have the disease, whether they were not responding to the medication because they didn't have the disease or because the medicine was not effective. Now we have the great ability that we can actually diagnose everybody in the study as having the illness. So the diagnosis was a big step forward, that we can do that. And then we've got some medications and infusions that we've proved can remove the things in the brain that cause the memory loss. They're called plaques. And what we've discovered is that if we wait until the dementia is well advanced, even though we do remove the plaques, we've proved that, the patients don't get a clinical benefit. And so we move from moderate dementia to mild dementia, and now we're actually studying people before they're formally diagnosed with Alzheimer's, because we can still do the same brain test and show that they have an excess of these abnormalities called plaques. And therefore we can offer them treatment to remove some of the plaques and hopefully prevent the clinical symptoms of Alzheimer's.
And Tabitha, the Alzheimer's Association for caregivers themselves is a great resource, isn't it?
It is, absolutely. We are one of the only places that have a 24-hour hotline with trained master's level clinicians that someone can contact us 365 days a year, 24 hours a day, to talk to someone and get information about research studies like Dr. Moore's, to talk to someone just to, if they're frustrated, to get resources in the community.
We're about out of time, but I just wanted to ask us one question, or both of you. What is that number one question caregivers have when they come in? What is that one thing that they want to put their finger on when they're taking care of someone with Alzheimer's?
Probably one of the number one questions I get is, of course, is it genetic? How long do they have? How long are they going to live with this disease?
And that question itself, is unknown as well. So you just never know. It's different spans for different folks, isn't it? All right. Dr. Moore, Tabitha, thank you so much for being here today. It is Lunch and More, and it's coming up tomorrow at the Innovation Lab here on West Market Street in Johnson City. And they want you to come by, and they want you to call ahead. If you'll call this number, this 1-800 number, 1-800-272-3900, and make a reservation for this. They would love for you to come out and learn more about what can be done as far as a caregiver with someone in your life that has Alzheimer's.